Hey everybody, hope you're having a great week. This week I had the opportunity to talk with Dr. Nicole Vane, and we talked about how she is using ozone in her practice as a dentist. She's a holistic dentist out of Encinitas, California, and she's been using ozone for the past number of years now. Ozone in dentistry has really grown over the past few years. I actually have a friend, she's a researcher at UCLA. I think I've done a previous video with her actually, but she talks about how standard practice in dentistry is to use bleach or Clorox, which obviously is really toxic and it has a lot of negative side effects. So ozone is a great alternative to that because once it does that initial oxidation and it's really effective at killing the infection and stimulating healing in that area, once it's finished with that, all that's left is just oxygen. So ozone is a great tool for dentists, and I hope that we see this snowball and continue to grow over the coming years. So take an opportunity to watch how Dr. Nicole Vane is using ozone in her clinic and some of the things that it's been extremely beneficial for.
I'm Dr. Nicole Vane, and I own a practice here in sunny San Diego. I've been practicing for 16 years. I have owned my practice now for 5, and for the past 7, 8 years, I've really trended towards being a holistic dentist. When I made that decision, I don't even think I knew what it was. I just wanted to do a healthier approach to dentistry, which meant being metal-free, not using mercury fillings. But then I knew holistic meant ozone. So I actually had no idea what ozone was or how to use it. I just thought I better learn about this because I'm going to be holistic. And then once I learned about it, I'm like, how is this not being used for everything? I mean, it's to the point now where I have a machine in my home because it does have so many uses and applications. I'm just continually blown away by it. The word's out. And I have had, as I was telling you in our email, 3 of my specialist friends, when I had the training for my office, out of respect for me, I invited a bunch of my specialists and I'm like, I really would like for you just to come and stop by and just hear a little bit about it. And all of them have now bought machines. One of my friends owns a mold remediation company and does carpet cleaning. So if you had like your dog pee all over your carpet, he has a bunch of ozone machines to get the smell out of the carpet and the floorboards. And so when he heard I was using ozone in the mouth, he's like, oh my God, what can you do in there? I want to hear. This is amazing because I know how it works for me.
What was the initial attraction that you had to ozone? What sparked in your brain like, oh, maybe I should do this?
So what made me want to do it was just that initial question. So I flew out to the training, and then that was the first training was like 3 days on just all of its applications in dentistry. When I came back to using it chairside, seeing an instant result on something was just something that made me transition just instantly. It was like, wow, this isn't hocus pocus. This is like real. This really works. So one of the main uses we use it for is for disinfecting and desensitizing. In the body, it makes the blood flow better. It makes the tissue heal faster, and it can vaporize an infection. So long-standing infection, it can absolutely clean it out, especially when we're not able to tactily clean it out. So if you had a deep gum pocket with a ton of pus, I can actually use ozone in the pocket and it'll soak into your root. And so not only will it go into the tubules inside of the tooth, but it'll actually clean out everything inside of that pocket and kill the bacteria there and stop the pus instantly. And it's so effective, it stops the bleeding. So it's painless. So ozone can actually, through the gas and the water, wick down into those areas, completely sterilize it, which leads to, even with a simple filling, the tooth not being sensitive, decay that we can't feel or bacteria is brewing can be killed. So it leads to a lot more conservative dentistry, and it's actually healing for the tooth.
I've seen it, especially in dentistry, the popularity of it, like you said, it was kind of difficult 7, 8 years ago to get training, has really grown. So, I mean, the market has, doubled, tripled over the last couple of years even of people that are using it in the United States. So it's cool to see a lot of different organizations start up, a lot of different training opportunities, and people are able to get it easier.
I use it a lot for cleaning out infection in the jaw if I'm doing a surgical extraction, if there's an abscess. And now all the root canal specialists I work with are getting it because of that ability to wick down all the way inside the tubules and around the tooth. Is if a tooth is really infected, it's a closed space that if a root canal is going to fail, it's because there's still bacteria that's lurking in there. So ozone's really the only way we can kill it. Our other traditional method is to soak the tooth in bleach, you know, so, and that doesn't go down, and you don't want it to extrude beyond the tooth because it's incredibly caustic and it can cause a horrible reaction if any of it gets anywhere other than just soaking the tooth. So the other beauty is that ozone is completely safe. So I use it a lot in surgery. I use it for root canals. I've now, I think I mentioned to you, I now have a machine, the Simply O3 machine in every single room. So that, so I have 5. And then I have the extra one at home and a big unit for making the ozone water. But to do the gas insufflations, my hygienists love it for root sensitivity. It completely occludes the dentinal tubules so that people with really electric hypersensitive teeth don't have to use things like Sensodyne. You can actually heal the tooth by using the ozone. And then especially with gum disease being the #1 problem with dentistry, we're able to clean these deep pockets that otherwise we wouldn't be able to get to heal other than with the laser, is by using ozone in the pockets. So the units are small, they're really easy to turn on, and then you can just deliver it in site-specific areas. So those are the main uses. If I ever have a filling that's close to the nerve, a deep filling, a super sensitive patient, there's a lot of attachments that come with the machine where I can just use a simple wand and cup the tooth, and I can show you how I use it if you wanted me to show you some videos on that. That take usually just an extra 1 to 2 minutes for the procedure. It works also for, there's cold sore attachments, so you can use it for cupping and cold sore. That same cup attachment, one of my hygienists had a sty, and she closed her eyes and she put the cup on there and her sty went away. So its uses are, I want to say endless. I mean, I just went to a cosmetic course where we were using it for spider veins and wrinkles. So I'm excited to try and do a lot of the aging experiment stuff on myself. And I have some wrinkles I'm going to start working on by injecting them with ozone. One of the breakout seminars I chose was through cosmetically oriented naturopath. And she uses it even for cellulite dissolution, scar revisions. So it was really exciting to see its uses in other parts of the body.
Ozone, you know, it kind of has this misnomer as a pollutant. Would you be able to address that? But also, what are some of the safety concerns with ozone, if any, and how do you work with that?
Yeah, there's a few. There's definitely a few. So its issue as a pollutant, when people hear ozone, they associate it with smog, the ozone layer, right? So we're going to get a sunburn outside because of our ozone layer. And actually, that's only when it interacts with other molecules. Ozone in a pure form, what I like to tell patients, is that fresh smell after a thunderstorm or with ocean spray crashing. That's actually ozone. Mm-hmm. So now I actually love the smell of ozone. When I walk in and someone's making it, I'm like, it smells, to me, I associate it with clean, fresh, but it does have an odor. Now, with the body, with it acting as an antioxidant or an oxidizer, we only have antioxidants everywhere in our body except in our eyeballs and in our lung tissue. So when we are using it in the mouth, we have to be careful people don't inhale large amounts because it will cause you to cough significantly because we lack those antioxidants. Same thing with if you get it in your eye. And then the way you'd remedy that in the dental office is we just use a fan blowing across the face if we're administering significant amounts in the mouth. And then we also use our high vacuum suction next to it. My home unit, I have a dog, a Cocker Spaniel, and they're very prone to ear infections. So I just have a little wand I stick in his ear, and it takes care of his ear infections literally instantly. It could be to the point where I can't even touch his ear. I can put ozone in it and it's gone within a day.
And it's interesting too how it works differently based on where it's applied and how it's applied.
Yes.
So like a systemic treatment still has medical benefit as opposed to like a topical treatment on a tooth where you're doing some anti-infection. Changing gears a little bit, if you're looking at how you used to practice or how you're seeing kind of the standard medical or dentist practice, why should they consider getting ozone into their clinic? Like what would be a good reason for them to transfer and start using that more frequently?
The seeing can only create the believing. Nothing that comes from this video until you get it in your hands and you see that when you have a tooth that you extract that's profusely bleeding because the body's just trying to bring white blood cells to the surface to flush out this infection, you shoot ozone in there and it stops instantly. And you see it bubbling in the socket, or if they have a draining abscess and you inject it in the area, you can see ozone just shoot through what we call a fistula, which is a draining channel of a cyst-like space, and it bubbles it, and you start to picture in your mind that cyst just collapsing. The patients heal better. There's no post-operative pain. I can't tell you how many root canals I've prevented. I'm in the business of, my belief system is about conservative dentistry. I want to be healing things. Getting my team on board, and I mean, I've worked with, in my almost 20 years of experience, I mean, I have people who've worked 20 years beyond my experience. So, and all of them now are believers only because they've actually used it. With spider bites, pimples, you name it, I'm like, go get the ozone, and it works. So once you see it start working, you wouldn't want to practice without it. The way it's valuable is, one, it's really inexpensive. Mm-hmm. And two, if I could tell people that if you use this, you're not going to have post-operative pain, swelling, infection. I mean, I haven't had any in 5 years that I've been using it consistently. That's huge. It's a huge practice builder. It's great for marketing. It's great in setting yourself apart as a provider. And it's inexpensive and easy. So if it's not, I mean, I have a $100,000 laser at my office. That's not something everyone's going to want to leap into. This is something that's easy to incorporate, easy to train your team, and easy to build value. So that's what I like about it, is that it really gives me the peace of mind of treating infection.
We talked a little bit about you do injections where you actually use needle and you're injecting in different areas. You're doing a spray, so you're exposing like topical things to ozone. What are your thoughts on the ozonated oils?
Love them. Ozone oil, for those people who haven't used it, is only truly stable form. If you use gas or water, you need to make a fresh batch all the time. The ozone efficacy decreases with a quick half-life if it's in the gas form or the water form. But if it's an oil, it's indefinitely shelf stable. Although if I'm not using it, I tend to keep it in the refrigerator. But the ozone oil is what we would use for scars, wounds. I would use it in any situation where I would use Neosporin. I would use ozone oil instead. It's something that helps rapidly heal. It works on cold sores, any wound. I had one of my hygienists have a terrible facial trauma, and she needed 30 stitches. And her plastic surgeon told her she was going to need revision plastic surgery. She also is of an ethnic background where it's typical to have keloid scars. And she came by the office, got the ozone oil, and her 2-week follow-up, her plastic surgeon couldn't even believe how she looked. She doesn't need any revision surgeries. She didn't even scab the way that you would typically see. When the scab fell off, she didn't have this crazy purpley, yucky skin underneath. She had just fresh, beautiful skin. And so the ozone for her was something that really aided in her healing. You can't even see the scar now. And it was something that, again, on onset, the plastic surgeon thought she would need several revision procedures. So we use the ozone oil. I just keep it on hand for pretty much anything that can go on.
The reason that the ozone can bond with the oil and not the water or air is because it goes into the oil and it bonds and it creates something, ozonines, which have some similar properties, but they're stable, so they do last a lot longer. Would you be able to share like a good success story or a good case? I know you just did the one on the ozone oil, but what's like one of your favorite scenarios in use with ozone?
it's either getting the tooth sensitivity where people can come in and have an incredibly sensitive tooth, and you can just cup it and they'll feel immediate relief that's lasts up to 90 days. But more often it's with the surgery. If something's just super nasty and gunky and gross, seeing such a rapid healing occur, I know is because of the ozone. So when you see it work in the socket, it's just you see everything, it upregulating the body's healing process and cleaning out some of the gross infection. And it gives me the peace of mind that if an infection reaches down like tentacles throughout the jaw that I can't scoop out, it shoots into those areas and cleans it out. So that's been my success story, is pretty much every time I use it on, I just did a surgery yesterday, and like, I'm literally saying to my assistant, did you see that? Because I'm wearing these like big loops and headlamp, because it's just bubbling in there and you just see it working, and then the bleeding just stops. So I don't have people leave biting on a ton of gauze all like that, and I know it's because of the ozone, because I've been doing this for 16 years and using it prior to not using it, I didn't have this amount of success.
Well, I really appreciate you taking the time to do this. I know that you're probably busy and you got stuff going on, so I'm super thankful for the opportunity to do it.
All right. Well, thank you so much, Micah.
Yeah, thanks, Nicole. We'll see you.